Well, thanks for joining us, everybody. My name's Dr. Lauren Young. I'm a naturopathic physician, as you guys know, at Collaborative. See some friendly faces and names here. And I'm joined with Dr. Julia Vitali, who is one of the primary care doctors that I've gotten to work with over the years. And we are bringing you this program to talk about some new findings in medicine that have come up and they're very much in the media right now, which is the new use of peptides for weight loss. So Dr. Vitali and I have been researching and looking at this for a while, and on the in-between patients kind of talking about, oh, it'd be great to do a program. We could do it so much better with nutrition and with lifestyle modifications and really like make it accessible. And so that's what we're going to bring you guys today, is kind of our new baby, which we'll be rolling out in the next few weeks. So the program is utilizing peptides, which Dr. Vitali will talk more about. And then along with it, we're going to be using a group class setting and nutritional guidance around the whole thing. And the reason for this is that we see these like semaglutide and these peptides as a tool for helping your body helping you make the changes that you want to make in your life, but there's so many other moving pieces that it's just not able to, you're not able to get the traction you want. So we're finding this to be a really exciting tool. I think it's exciting too. Thank you. I think it's going to be a great tool for our patients, and we're really seeing some exciting results with it already. And so this program, I should give you some of the logistics, is going to be group classes. We're keeping it to a minimum of 10 people at a time right now. And the way we're doing it, where we can make it more cost effective for people, is we're using a compounding pharmacy for the semaglutide, which is Wegovy, correct, Dr. Vitali, or Ozempic?
Yeah.
So it is a prescription, but many times these prescriptions are only covered for specific diagnoses and are quite expensive, especially if you have a high deductible or those type of things. So what we're doing is going through a compounding pharmacy to make it more cost effective. And by doing that with group classes, you will have some one-on-one evaluations, which we can talk about. But that will make it more cost effective. So we're hoping to have it be $1,500 for a 3-month program, which is substantially cheaper than anything else we've seen on the market. So that will include check-ins throughout the month, both in person, where we're looking at percent body fat and muscle mass, making sure people are losing weight in the appropriate way, and also like getting their vitals, checking in with a doctor. And then also doing group classes where we'll be troubleshooting any kind of issues people are having with it via a Zoom setting. How'd I do, Dr. Vitali? Would you agree with all that?
Yeah, so the hope was we'd be able to get you the medication as well as all the support that comes with knowing what's actually going on with your body while you're taking the medication, and the medical support to understand the nutrition behind how to make this weight loss sustainable.
One of the things that we had kind of been playing with when we were talking about people getting on this medication is I've seen people prescribe this from their physicians with no guidance on their diet, no guidance on how many calories they should be having, on how much protein they should be having. And so it was a big thing for me, is that these, you could easily lose muscle mass and not body fat. You're not going to have it be as sustainable because you're going to eat so little calories. So really our goals are going to be, when people sign up for this program, it's going to be, again, classes of 10, where we will then have you evaluated for your percent body fat, muscle mass, and kind of a goal for caloric intake. And then with that, like aiming for X amount of protein, that type of thing. Everyone's going to get an ebook with a habit tracker, diet kind of plan, goals for dietary things, that type of thing, so that we can make this a tool that helps you make changes. So I'm sure people have a lot of questions. So Dr. Vitali, do you want to speak to semaglutide in general and kind of how we came up with this game plan?
Yeah, so semaglutide is a peptide, and that term's being thrown out a lot. A peptide essentially is a protein, and it's a protein that your body naturally makes. And so semaglutide is synthetic and was created as an injection. And so it activates metabolic pathways. And so the pathway, or the class of medications that semaglutide is part of, is glucagon-like peptide agonists, so GLP-1. In prescription medicine, these It's Wegovy, it's Ozempic, it's Mounjaro, and a couple other medications that were originally created for diabetes, but then they found independent of diabetes, patients were having weight loss, and it kind of exploded because people in Hollywood started using it. But then all these studies came out, and we can talk about the studies that showed that even people who are not diabetics, it's still safe for them to use and they have successful changes. Part of how it works is that it works on insulin in your body. So by lowering blood sugar, kind of keeping your sugar, instead of letting it go up and down, it keeps it within a certain range. It also regulates appetite, slows down the GI tract to make you feel fuller. So people tend to have less sugar cravings or carb cravings. They tend to be able to make better nutrition choices. They also, as well as eating less food, they tend to find that they have more energy, they feel better. There's a lot of positive that come for this that play into the weight loss.
I mean, and there's so many benefits by just not eating poorly. And this is, I feel like it's a great tool to helping with, willpower, so to speak. It just, you are a little less hungry, you don't have those carb cravings. It acts pretty instantaneously. And so then from there, you can implement your goals. And I think the thing that we're talking about a lot is making SMART goals, setting yourself up. And SMART is an acronym for like sustainable, manageable, attainable. There's like a whole bunch of things. Basically, you want to set yourself up for success where these are going to be habits that you're creating for yourself that are longer than just while you're doing, the Ozempic, semaglutide. So that's a big piece of this too. So do you want to talk about how it's administered?
Yeah, so part of the reason that it's so expensive through insurance companies, so even if people have insurance, it's often not covered because it's a newer medication. And if it is covered, it's still costing people $800 to $1,200 a month for the 4 injections, because it's a injection and there's a patent on the pen, the way it's injected. So we're able to get it through compounding pharmacies, which unfortunately insurance also doesn't cover. But we're able to get it as injections for a lesser price, still not super cheap, but definitely more manageable for people. And so we get it as a vial and then little syringes with a very, very small needle, that it's not like getting a shot, an immunization injection. It's a small needle that can be injected into your abdomen, into your thigh, into your arm once a week. And so what we do is we start people at a lower dose, and over time we increase their dose to manage the balance of side effects and to help with their weight loss goals.
I'm sure people have questions around side effects and other things like that. So I'll kind of keep doing Q&A with you. So side effects are obviously any medication. I love, there's a John Bastier, who's like a famous naturopath, has a quote like, no medication has side effects, just effects, right? Like, so there are other things that it could do to your body. It's slowing down your GI tract, right? So how does that impact us?
So the most common side effects that people see are GI upset. That could be nausea, it could be more burping, it could be diarrhea or constipation. It all depends kind of how your GI system responds. So part of our plan is to have a lot of natural support, nutrition support to help manage the side effects. There is a possibility, rare other side effects could be fatigue, although most people report better energy. I do think it's important to know when it's contraindicated. So in the studies in rats, they found in 7 rats developed thyroid carcinoma. So for anyone who has a personal or family history of thyroid cancer or multiple endocrine neoplasia, so an adrenal cancer, it is contraindicated. They didn't find it in any of the human studies, but just it's one of those better safe than sorry situations. So we do recommend that anyone with that personal or family history not take it. That's really the only major contraindication.
Yeah, I mean, and again, it's like everyone's being extra safe around it and cautious. So,
Yeah.
that makes sense. Um, let's do some questions from everybody's like already chiming in, which I love. I love the engagement. So I'll read you questions as we're kind of going. So does it help with perimenopause or menopause symptoms?
So I would say that hasn't been directly studied, but when we
Mhm.
talk about perimenopause and menopause, which I do a lot, one of the main goals that helps manage symptoms is regulating blood sugar because it plays into your cortisol levels and that fight or flight response. So I
Mhm.
think that indirectly it would help manage the symptoms, but there's not any studies, anything to prove that.
Yeah, I definitely think, one of the things that can happen with menopause is it does get harder to lose weight, because your hormones are shifting. And so this is definitely a tool for someone who is perimenopausal, who's having a hard time losing weight, but I don't know if it's necessarily going to suddenly reduce your hot flashes. Um, I'm, it'll be curious to see if that does help. I have a feeling it will too, because of the blood sugar regulation piece of things. And because it's easier to make good choices. And I've definitely seen a lot of my patients have a hard time with like if alcohol and caffeine and sugar can definitely exacerbate those symptoms. Um, so is there a certain amount of weight to lose? One of the things that we had talked about is that this can be effective for people who have a lot of weight to lose, or they have goals that are a little more long term, like a larger amount of weight to lose. And then it can be effective for people who just want to lose 10, 15 pounds, not just, that's hard to do, but
Yeah.
it's a little easier with this medication for sure. And so we did not put a restriction, right, on BMI, but we are going to be mindful of that and not just let, like, you have to aim, it has to be a realistic and healthy goal for your body. And again, we're looking to really monitor and make sure people don't lose muscle mass, that they're only losing body fat, and that it is reasonable, makes sense. But I would say that the question was like, is it appropriate for someone who wants to lose 10, 15 pounds? That would be very appropriate, I think.
Yeah, when they did the studies, a lot of the initial studies were done over a course of a year plus. And so people were losing, you know, 5, 10, 15% of their body weight is how they looked at it. But there's also studies of people who were in a 20-week study, so a 4-month study, and they were still found to be uh, losing weight as well because the weight loss tends to start in the first couple weeks. I think it was the mean weight loss was 10% of body weight in 20-week studies.
Mhm.
So if you're going by percentage, but we kind of talked about what's people's goals, and usually it's 1 to 2 pounds a week is really when what's sustainable for people because the goal is again not just lose weight but be able to keep the weight off once you're not on the medication. It's something people could be on long term, but our goal is always as little as we need, you know, for as little amount of time as we need it.
Exactly. And I think, what our goal is like that, yeah, that this is, weight loss in and of itself is not balanced, right? Like, I mean, you can have a balanced diet and lose some weight, but to reduce your weight, you have to tip the scale towards less calories so you lose that weight. And this is a great tool for that, but we want to use it to give you all the habits and patterns and lifestyle pieces and like the things you want to implement with that so that it's sustainable after you're off of this medication, which is our goal for everybody. And so we also don't want the weight loss to be drastic. That can be stressful for your body. And so we want to make sure we're doing it in a mindful way, which is why we're going to be keeping an eye on everybody. And there's like check-ins throughout the whole process of the 3 months. And certainly we will be keeping people on after 3 months. We're going to have this be a rolling thing where we, maintain people on this and manage everything. Um, what was the other piece of that I wanted to bring up? So yeah, so I think that the goal is to, we want to make sure we're not stressing out your gallbladder, your liver. There's a lot of, think about a pound of body fat that has to clear out of your body. There's a lot of things that have to happen in your body for that to happen. And it happens easily with this program and this medication. So we want to make sure that we're supporting your body and it's not going too aggressively. There is a question about a thyroidectomy and if is that a complication? I would be concerned with why someone had their thyroid out and how that would play a role with any kind of risk of a history of a family history of thyroid cancer, personal history of thyroid cancer. Would you agree with that?
Yeah, if it was out due to a history of cancer, because someone could still develop the multiple endocrine neoplasia in other parts of their body, that would be it. If it was not due to cancer risk, then it wouldn't be a contraindication.
Okay.
And someone asked about having high blood pressure.
Oh, yeah.
Yes, you can take it when you have high blood pressure. And in a lot of the studies, they found that people's blood pressure improved, which we know being able to exercise more, lose weight helps improve blood pressure. So it's something, that's why it's also something we want to be watching, and we'll be monitoring your blood pressure while you're in this program.
Yep. Yep. So it is something that like, your doctor should be aware of. There's a couple logistics questions I want to make sure I address. One is, does the cost of the program include this medication? That is a yes. So, like we said, typically Wegovy, if it's not covered by insurance, is $1,200 a month. This program, including the nutrition support, the bioimpedance analysis, everything we'll be doing for check-ins, the Zoom meetings, and the medication is $500 a month. We're trying to make this very accessible.
And the medication will be mailed to your house.
Yes.
How it's done.
It does mean you guys will be doing the injections. We're going to teach you how to do that. It's really not that bad. And they're itty bitty needles. You don't even feel it. So is the ingredient same as getting it from a compounding pharmacy versus a regular pharmacy? Yes. Pharmacists are pharmacists, just some of them being compounding can like create the medication themselves instead of, again, like buying it from the pharmaceutical company directly, where they have that injectable pen, which is really cool, but it sounds like very expensive as a patent goes. So there's just some like some people who've already had some experiences with the medication saying like the only real side effect they've had so far is GI constipation. So again, it's slowing down your GI tract. So it could really, you could have some nausea, some constipation, or the other way, like you could have some diarrhea. And those are all things that we can help triage, and we have a kind of a game plan for. So the program includes these Zoom check-ins, you'll do a weigh-in with a bioimpedance analysis, and then the ebook is going to include like, everything you need to know, like lifestyle medicine 101, and then some meal planning stuff, as well as like, here are all the side effects and here are some natural things that would be good supports for you. And then we're going to be available to everybody to help kind of triage this. A question around SIBO and semaglutide. That has been one of the things that I've had in the back of my mind for a little while, was that if you have a history of small intestinal bowel overgrowth, and typically that happens because you've bacteria that's kind of crawled into your small intestine, would doing a semaglutide that affects motility increase any risks or issues with SIBO? It could exacerbate GI symptoms. So that could be something to be mindful of and discuss with your doctor before trying that medication. If you're, back on a like regular diet and you're not having to manage anything with low FODMAP, and you're feeling like you're in a good spot motility wise, then that would be fine. But I would say that, if you have a history of SIBO, that might be something to talk about with your doctor first. So what happens when you're done with doing the shots and you stop, Dr. Vitali? That's a good question.
Yeah. So part of the thought of how this works, because originally it came out, when it first came out, people were saying, oh, if someone's on this, they're going to have to be on it for life. And I knew that wasn't true, just from the fact that I had patients who had started this or similar injections for diabetes, a couple of years ago, had lost weight, got their diabetes under control, gotten off the medicine, and have been able to stay off it. So I knew it wasn't for life for everyone. And now they're really showing that it's not. And the thought with why some people have a hard time losing weight, even though they do certain things, is a metabolic set point for weight. They think it's something metabolically between the brain and the hormones in the body. And so this kind of is like an ignition that helps change your set point of weight. And so our goal is for when the program is complete, which we're saying 3 months is our initial goal, because a lot of people will have substantial change in that time, but for some people it may be longer, that your set point for weight would be different. This is kind of similar to the thought of what happens when people do gastric surgeries, is changing that set point. Um, I don't know if that answers the question. Is that the complete means different things, but your body set point for weight would be different. And so the goal is that it helps restart the metabolic processes at a different point.
Mhm. I think that the concerns of regaining weight with any kind of dietary plan is an issue, right? Like you don't want to yo-yo your diet, like you don't want to yo-yo in weight, and you don't want to put this work and investment into it, and then just to have you see you gain back the weight. So I hear that is a concern for anyone doing any kind of program. I think this is where we're saying this is a tool for the lifestyle changes we're going to make. And so people go on Ozempic and still eat ramen noodles, they're losing muscle mass. We know that muscle is not just like, important for like feeling strong and those things. It's metabolically very important for our bodies. It's, making your mitochondria, which make energy in your body. It is metabolically a lot more active than body fat. And there's a lot of pieces to that we want to make sure we're watching closely. So our goal is that people don't gain back weight with it. And I'm pretty confident that we are going to have good supports around all of that. We have this program where we're going to be helping people through it. I know there are other programs in the hopper with some of the other doctors to make sure we keep the lifestyle pieces of things going. And so, Dr. Pasternak's doing the fasting mimicking diet. Dr. Fiorito is going to be rolling out like a good foundations, keeping people on balanced Mediterranean diets. So we're going to make sure that once you've made those changes, we help support you with the shift with it. So it's like any good habits that we're putting in place, it's going to need to be maintained, but I think it's going to be sustainable. Would a family, is there, so there's questions around if you have Ozempic or any of the other medications covered by insurance. We will probably be rolling out we've talked about rolling out like the lifestyle piece of this, so that if you have the prescription already, we will support you with the lifestyle piece of things at the same time. And it will be obviously a different fee because of the fact that there's no prescription involved. We're just still kind of working out the logistics of that, because it's making sure we can get everybody in. So I understand everyone's going to have different schedules of this. So we're going to have the Zoom meetings at one time, and then you can like schedule your check-ins with the doctor in the office around your schedule to a point. So we're just trying to work on the logistics of how to support everybody with this. The family history of diabetes. So it says is that is the concern, I guess, that they're afraid that it's going to trigger having diabetes, and that would not be an issue at all. No, that if anything, again, typically even shifting your body weight, I think they said like the 10% we were kind of aiming for as a goal, they've shown that reduces your inflammation dramatically. Like even shifting a percentage of your body fat can really help your entire metabolic system so much. So that's definitely something that I would say is only a benefit as far as that goes. How long can someone be on the medication, and what happens when you come off the medication? How long have the people been on it in the studies, Julia? No, Dr. Vitali?
A lot of them were 64, 68 weeks, but then the studies end. It's safe to be on it long-term for years. Again, that's not our goal. Our goal is to help people be off of it and not see that rebound weight gain.
So to recap thank you, that makes sense. To recap the question around the fact that it works by kind of slowing gastric emptying, I think that's a concern for people with GI issues. That is the mechanism of action, like one of the main ones that we're seeing, right? So people who are concerned about if they have gastroparesis, if they have a lot of GI issues around that, this may not be a good tool for you. You know, I definitely think from a naturopathic perspective, your GI tract being balanced and healthy is an important piece of things. And I think, you know, our goals are to have this medication work, but also keep your GI tract healthy. But if you're having issues going into this, I think working with your physicians to make that better would be your first goal.
And I think, I know we're the ones talking about this, but you know, all the naturopaths, all the primary cares in the office are familiar with what we're doing. We've talked about it. And so I think even just asking them directly if they think you're a good candidate for the program, they know your history and they'll know.
Yes, yeah. And in fact, there's some questions. I know some people are getting excited. So how we're going to have the initial sign up for things is actually going to be through your doctor that's established in the office. So if you're interested, I would ping your naturopath or your DO and say, hey, this is something I'm interested in. Our colleagues are going to be annoyed at us for this. But and just because there is some initial blood work we're going to want on everyone. We want to make sure that you're a good candidate and they kind of help you screen and make the decision too. And also because we're finding that there's a lot of interest in this, so we want to make sure we're supporting everyone the way we need to. So, you know, the first step, if you were interested, is you can certainly shoot us a message and we're going to create a database and like an email list. Because my hope is to keep giving people a lot of resources who are in this program. But ping your naturopath or your DO and have them, they know what blood work you need to be able to get that, get the ball rolling and get on the list to get started. Because again, we're doing this 10 people at a time. So, but we're going to keep rolling it out as much as possible, you know, depending on what people need. It is not covered by insurance. It's a program, it's like a class, not is how we're kind of, it's not office visits. You know, the office visits are still covered with your doctors, and but this program is not something that'll be covered by insurance, and it's kind of because it's the medication and it's the whole package all at once. The visits where you go in and see the doc to get a bioimpedance analysis and that kind of stuff will not be a charge to your insurance either, though. There will be no copay for that. You just kind of come in, see the doc, do your thing, and then you're good. So that will not be something that will be an additional fee. It's the $1,500 for the 3 months, and that's it. You could do it for 1 month. It would be $650 for 1 month or $1,500 for all 3 months is how we're breaking it down.
The classes will be virtual. We'll do Zoom classes like this with 10 participants plus us.
Yeah, there's some messages to me just that like only specific types of thyroid cancer are a risk. Yes, but I think we're saying all thyroid cancer is basically ruling us out. Or are you saying that certain ones will still be okay? What do you think, Dr. Vitali?
Yeah, I think at least initially I tend to err on the side of caution. And so it is still a newer medicine. So I'd rather have everyone with a history of thyroid cancer.
Yep. So back to, this is easy. We don't even have to, we can just keep going through questions. This is great. I love it, guys. Thank you. You're making this a lot easier. The classes will be virtual. The check-ins will be in person because we want to get your blood pressure, all that stuff again, because we know people are on medication. We don't want anyone like bouncing around too much. There will be potential for other supplementation if you want it, but you don't have to do any other supplements, but there are things. My dog knows I'm on the bed. I apologize. There are other medications that supplements you could take if you wanted to. There's nothing that you have to take with this program though. So he's going to cry. I apologize, guys, until I pick him up. So, oh, Sammy gets to be on the Zoom video. Sorry. He opened the door. I'll be right back. So, the only cost really would be the class and the program, but there may be other things you could add in. There are some people suggesting they've done other supplements and things like that in the past with the semaglutide that they've done. Again, we may speak to there's things that can be supportive for your GI tract or for to keep your health goals and your body composition goals on the right track, but nothing you have to do. Are you seeing the questions too, Dr. Vitali? I just want to make sure
Yes.
you're popping through. I have several direct messages. I'm trying to make sure I address them all too.
Someone asked if they'd already started semaglutide, if we'd be able to start them at their current dose, or they'd have to start the program from a blank start. And we'd be able to start people if they've already had a history with semaglutide. And one of the things with this, and the dosing, is that initially the dosing is recommended once a week. So we have this program that we set up with dosing, and we titrate up over the course of 3 months, but can be adjusted. Some people choose to go at a slower pace because they're finding they have either side effects, or they're having benefits. They're having weight loss. They don't want to go up until they feel like they need to go up. So that's something we'll work with you. We will make the dosage, you're not stuck in the plan. We'll make it for what you need. And one of the things is, sometimes when people choose to be on it longer, they find, I don't do injections every week. I maybe do them every couple of weeks. Everyone's body is a little bit different. So at the beginning, yes, we say every week, but you may be able to go longer between in the long term. And the other thing is, sometimes people go on this medication, then they take a break for many months and want to restart. And there's a lot of different recommendations for restarting. So again, that's something we'd work with you for.
So even though it's in a class setting, again, so that we can make it as cost effective as possible, it will be still tailored to the individual. And so with that, like, there's the, what happens after 3 months. We will definitely be keeping people on past 3 months. That is if they haven't hit their goals yet as far as their weight loss. And so it'll probably become a rolling thing. And so that goes along with the maintenance program piece of things. You know, that there will be some other kind of 3-month thing that we'll be rolling out that's very similar. To be honest, the price will probably be very similar because the medication price goes up as the dose goes up, but we're not changing that on everybody, right? So that's something to be mindful of, is if this is about like as cost effective as we can make this. But there is several people interested on the lifestyle piece, if they're already on Wegovy, if their insurance is covering Ozempic or one of those medications. We will be rolling out the lifestyle support piece of things as well. So that will be coming for sure. So if you're one of the ones that gets to have it covered by insurance, that's awesome. I will say, we will not be prescribing the medication to have it covered by insurance. We are only going through the compounding pharmacy and doing this program that way. So if you think you have it covered by insurance, you need to talk to your primary care doctor. One thing I'll say is Dr. Vitali is a very coveted primary care doctor. And so she will first talk to her patients and directly around that, but she can't prescribe it for everybody. And she, just because we're doing this program, unfortunately doesn't, she's still not your primary care doctor. She's just doing this program to help support you. So another quick question was they're finding that there's some natural GLP-1 agonists that can sometimes be a support, so that if you were to stop the medication, could you use other natural things to support this? Yes, there's definitely a lot of ways we can help support people on the medication if they're not getting the dose they want, or if once they've stopped, there's a lot of natural supports around all of that. So Dr. Vitali, would you mind speaking to how this medication helps with insulin resistance?
Yeah, so it would sometimes, especially patients who work with naturopaths, will follow their insulin levels as they see a rise in their blood sugar levels and a rise in their A1C, to know, it's time to make more lifestyle changes because your body's becoming more insulin resistant. This will help support that. It'll help prevent worsening of an insulin resistance. So someone who type 1 diabetics who require insulin injections because their body's not making the insulin it needs wouldn't be a candidate for this program, because part of the way the medication works is to help your body release its own insulin. So we're not giving you insulin, we're helping working with your body's system. So it helps if you are not completely insulin resistant, meaning insulin dependent on medications, but it would help kind of reverse an insulin resistant concern. I also saw that you asked questions about the side effects into percentage. I think it's really hard to say because a lot of the side effects happen in the first week or so. And then as their body gets used to the medications, the side effects become less. So I don't have a clear number on percentage. I could look at the studies and let you know specifically what they found in the studies. It is a rather high percent that get GI upset. Again, but that being said, very few people drop out of the studies or stop taking the medications because of the side effects. For everyone, it's your own risk benefit of, is it worth it? But I think most people do find that the side effects are not that severe and that they're very manageable and that they do improve. It's not for as long as you're on the medicine that you have side effects. It's really worse just at the beginning as your body gets used to the medication, which is why we started a very low dose. Someone asked also if side effects are worse with overeating. Definitely that can be true. The nausea is worse with overeating or veering off healthy eating. So eating more protein, drinking more water, that helps manage the side effects.
I would say, yeah, healthy fibers and hydration are probably two of the biggest things that we'll get into. And yeah, adequate protein is the other piece of things. But one of the issues was they were saying like people just eat like they usually were still, but typically that doesn't happen, honestly, because people are feeling full. You just feel full, Can you do the program without injections? Unfortunately not. The peptide is not, because peptide is basically a group of proteins. If you eat it, it just gets broken down into like protein amino acids in your body. So it wouldn't work unless it's only stable if you inject it, unfortunately. Just so everybody knows too, we are recording this. So I hope you don't mind that piece of things. And we will make this available on our YouTube page pretty promptly so that you guys can go back and watch me pick up my dog again. And what if someone has parathyroid issues? I don't think that's a contraindication. Do you?
No, it hasn't come up as no.
Yep. Close to the thyroid, but so different. Yep. So again, is blood work, so the 1,500 for the 3-month program, the only thing that would not be included is the blood work that has to be done prior to you being like joining the program, because we need to make sure your kidney and liver function is good. We need to make sure, your thyroid is okay, those type of things prior to this medication. There's a lot of questions around like other thyroid issues, like there's just hypothyroid would not be a contraindication, correct? Yeah. So, no. Yep. Underactive thyroid is not something that would be an issue. So there's a lot of like, so when does all this start? We are starting the first class in a couple weeks. And then we will be rolling that out monthly and or maybe even 2 weeks, depending on the demand and our bandwidth with it. So very soon. So the ebook is in its like final phases, almost ready to be born. There are questions about, again, being a candidate. You don't have to be a primary care with Dr. Vitali. Dr. Vitali doesn't have to be your primary care. However, you do have to be established with at least one of the naturopaths in the practice so that they can do that initial screening blood work. So if you haven't been to the practice in 3 years, you can jump back in, get established with somebody, and let them know that this is one of your goals, and they'll direct you to get to us.
So I think too, if you have a question, if you're, your own personal history, are you a candidate? Ask
Yeah,
your provider, and if they're not
that's a
sure,
great
they'll
question.
ask me. Um, because
Mhm.
it's, I can review your chart and say whether you're a candidate or not for the program. I know someone asked specifically about um, cysts on the kidneys, not a contraindication, gallbladder gone. So part of the thought is that people who have sudden weight loss can be at high risk for developing gallstones. So that's something that we'll monitor for. Not very common, but is a possibility. So if you do not have a gallbladder, you have less of a risk there. So there's no contraindication there.
Yeah, I mean, so in our goals as a naturopath being involved in it is there's like 4 ways you detox in your body. So your breathing, your sweat, urination, and defecation. So we're going to be really on top of making sure all of those are happening, because it is like, pretty steady weight loss. And then so it is your body getting rid of all that stuff. We want to make sure we're supporting that. So the only that doesn't mean that, like, any issue as far as like your gallbladder, if you have one or not, or your kidneys, as long as we're supporting your 4 emunctories there, it should still be probably okay. So I would talk to your doc and make sure. I know Dr. Vitali and I have some patients who are having great success with this. We don't have any testimonials yet, but I'm sure that is a thing. There is a lot of, like, I mean, if you Google Ozempic, it's like every other article out right now in health news. And so there are a lot of like thoughts and things around it. Again, I think that the lifestyle piece of things that we're bringing to the table and making sure we're maintaining a healthy body composition is going to be a game changer for a lot of our patients. I'm excited about it. So next steps, if people are interested, message their naturopath or their DO, and we can get you on the line to have a conversation with us. We will be launching a page around the rest of this in this program, and then one of our front office team can reach out if this is something that seems like a good fit. The blood work we are going to need prior to it does depend a little bit, I guess, on their health conditions, right? Because we still want a hemoglobin A1C for everybody, or no? I think we said yeah, right?
Yeah.
So a CMP, which looks at your electrolytes, your liver function, your kidney function, just again, those emunctories, making sure everything works as far as your basic organs, your thyroid we want to check, and your blood sugar. I think those are the main things we wanted to look at. So I think that's the only stuff we put in there, right?
Yeah.
Yep. As far as people not being able to get their Ozempic, this is compounded semaglutide, so it is not the prescription that has the fancy patent pen. So we're not impacting any people with diabetes access to this medication. It's just that Ozempic can't make it fast enough.
Yeah, the back order issues was actually not the medication, it was the pens. They couldn't make the pens in the factories fast enough for what people needed them for. So this is separate from that.
Awesome. Well, thank you so much, everybody, for joining us. If you have any other questions, again, you can certainly send them our way. If there's any, like, is this right for me? Talk to your physician, and stay tuned. We'll put some more information out there, and with it, testimonials for sure.
And if I know there were some direct messages, so I'm going to go back. And so if you want to log in, I stay logged in. I will answer your direct questions. Just give me a moment as I'm going through.
Oh, there's a quick question about what compounding company we're using. I believe we're going with New BioAge, correct?
Yeah, New
that's what we
BioAge.
decided. Yep. So it's a sterile compounding. They do a ton of this, and we vetted them, and they're part of that organization that we kind of did a lot of our continuing ed with. So yeah, thanks so much, guys. Thanks for your interest. Stay safe with this horrible snowstorm we're having. And we will talk to you all soon.